video on dealing with depression. In our last video, we will basically learn on the causes, diagnosis, and treatment of depression. If you have not yet subscribed to our channel, please do so to get more updates on this and more with me, Phineas Kome. In this video, we will basically look on causes, diagnosis, and treatment of depression. Follow up with me up to the end, and we will fight this big giant called depression. What is the first thing that we need to note? I want us to basically to understand the need for more neurotransmitters in the brain. If we don't understand this, we will not know how depression kind of tracks our mind, and how is it that depression is associated with poor concentration, attention on task, or how does it impair our memory. I would like to tell us that serotonin, noradrenaline, and dopamine are neurotransmitters found in the brain, which allow for the transmission of impulses from one nerve cell to another across a very tiny gap on the synapse on the brain that is called synapse. So in depression, it is thought that there are too little neurotransmitters in the synapse. So that's why you see that due to small volume of neurotransmitters in the synapse as a result of depression, it will result to poor concentration and impaired memory. Let us learn how message is sent to the neuron and how it is received. First of all, incoming messages are received by the dendrite. The message is passed to the end of the axon. So next, in the axon, sacs containing serotonin are stimulated to release this chemical substance, which are calling neurotransmitters in the synapse, to assist transmission of message from the chemical signal part to the synapse. This gap that you are seeing here, from one neuron to the receiving neuron. Then serotonin stimulates the receptors to open, transmitting the message to the next nerve cell. And then after this, the message is sent and the receptors release serotonin back to the synapse. So you see that is how the message is being transmitted. So that is why I want to emphasize the need for more neurotransmitters in the synapse. And most treatment of associated with depression are aimed in increasing the levels of neurotransmitters in the synapse. In this case, in this video, we want to look on the causes of depression. So we are basically saying that generally there are a myriad causes of any identical depression. However, there are common causes of depression that we all need to check out. One is abuse. How is abuse related to depression? Abuse may be physical, maybe for example, beating, sexual, or emotional abuse. This can make you more vulnerable to depression in life later. The second is age. You may wonder how age is associated with depression. Small children are not at high risk of getting depression, but however, the aged people. And what we are saying is that aged people, or basically the elderly, are at high risk of depression. This can be made worse by the fact can be made worse by other factors such as living alone or inadequate social support. The next thing is gender and genes. We are basically saying that a family of depression cases, maybe a family that has been always having depression cases, one may increase the risk of contracting depression, maybe if you come from such a family. Huntington disease or cystic fibrosis are associated with generic depression, and these two can also be cured. The next thing is gender. A research was carried out and shown that 1 in 8 men is suffering from depression. This maybe is about 20 or 16%, but it is higher in women, such that 1 in 5 women are suffering from depression. We noted that in our research, that women than men are at high risk of having depression. Nobody sure knows why, but frequent hormonal changes in women may play a key role in this case. So the next thing we're going to discuss is conflict. Conflict may be either marital conflict, conflict at place of work, school, and etc. Conflict causes low self-esteem to the defeated party. This brings sense of unworthiness after defeat, which may result to depression. We have to take note of this and to ensure that every conflict resolution method leads to a win-win situation, so that no one feels low self-esteem or is engaged into depression. The next cause of depression is some medication or certain drugs. Drugs such as benzodiazepines are associated with depression. Other drugs associated with depression include Myorizan, Clarkvis, Amnestim. This is the Clarkvis that I'm talking about. This is the Myorizan. We also have such other drugs such as corticosteroids. We also have some other drugs such as the anticholinergics, opioids, and finally barbiturates. Barbiturates are also associated with depression. At times they cause depression. They alter with the neurotransmitters, and that is the symptoms of depression. And also some blood pressure medication, and you have to know the kind of medicine that you take and their side effects. The beta blockers are also associated with depression. The next cause of depression, basically and especially among youth, is drug abuse. How is drug abuse associated with depression? For instance, a person lacks, maybe for example, the addict. For addicts, for them to enjoy the leisure activities, to enjoy maybe what we say that maybe to have interest and enjoyment in leisure activities, to have energy and not withdraw and not even to show tiredness, they have to have the drug that keep them alert and keep them excited. For example, if they don't have drugs, you'll find that they lose interest and enjoyment in activities. They have depressed mood. You'll find them at place sitting alone, thinking a lot. Another thing is that they have low self-esteem and maybe ideas of self-destruction or suicide. And basically, and which is very common, is that they show reduced energy and withdraw and mark tiredness on slight effort. They will not even do work at all. The next thing cause of depression is loss of a loved one. How does loss of a loved one cause depression? Maybe you lost your son, your daughter, your mom, your dad, your grandpa, your great grandpa, your even whoever that you lost is a loved one. So this causes depression. Maybe you used to spend a lot of time with these people. Maybe they used to give you confidence. They are the people that maybe used to psych you up. That is when you find these people, and generally maybe they will have that depression. The next cause of depression, others include major events such as losing a job or even losing a source of income, getting divorced, or even a breakup. Maybe an engagement, especially in youth. Maybe you're engaged in a girlfriend or a boyfriend. At the end of the day, you lost him. You maybe have that depression for a period of time before healing comes into your heart and accepting and moving on. But however, there are many ways in which we will discuss at the end of the video. Make sure you watch up to the end so that you can see how you are going to deal with this thing. Serious illness and chronic illness. The pain associated with this disease can bring disturbed sleep, can bring a diminished appetite and weight loss, and other unexplained symptoms, and most of it bleak and pessimist view of the future. You don't see like if you live again. Maybe, for example, you are at an accident, you broke off your leg. There's bleak and pessimist view of the future. You don't think even like you'll never walk again, and this is what you call bleak and pessimist view of the future. The next thing we are going to discuss is on the diagnosis of depression. And what you are basically saying is that there are a number of different symptoms of depression, and they may vary from one patient to another. These main symptoms represent a change from one patient's normal mood and shouldn't be present most of the time. And basically, for a period of 2 weeks, that is the length of the time that one should have a self-rating scale and to know whether you have depression or not. So you are basically saying that this may be developed over a period of weeks or a month, and for you to make this diagnosis. And the diagnosis of depression is always meant for when a patient has low mood or loss of enjoyment and is interested in activities coupled with symptoms listed in our last video. So what I'm saying is that you cannot diagnose the first day that you have depression. Depression is diagnosed after 2 weeks. You cannot see just one simple sign of depression and you can't really say that I'm depressed. No, that is a change of mood. And what I'm saying is that depression has to be diagnosed for over a period of 1 week, and there are not a specific blood test or other investigation that can be reached to diagnose depression. Kindly check on the course of the diagnosis on the self-rating scale that I'm going to show you here. So this is a self-rating scale. I have a scale that looks like this. For the numbers, you have to have 2 weeks. Every day you feel any sign of depression, kindly note. If it is some of the time, kindly note under the respective column using tiling method. At the end of the day, make sure that you have the total number of time when you have been feeling these things, and have at the end of the day the accumulative SDS low score when you're going to accumulate all the summation of the total frequencies when you have been feeling these kind of symptoms. And at the end of the day, note the SDX index. You'll be able to calculate SDX index by using the SDX raw score. The maximum raw score should be 80. So SDX raw score, the SDX index is expressed as a percentage of the SDX raw score. I'll show you how to calculate the SDX raw score. Simply, this is how you can get your SDX index. Conversion of raw SDX score to SDX index. So what you are saying is that index is equals to raw score, the SDX raw score that you got from the summation of the total frequencies, divided by maximum score, which is always 80, multiplied by 100. So index is always expressed as a percentage. Let us kindly see how we can generally interpret our index. How to interpret the SDX index. So if your index is below 50%, it denotes that you are within normal range and therefore you do not need psychopathology. If your SDS index is between 50 to 59%, it indicates presence of minimal to mild depression. If your SDS index is between 60 to 69, it indicates presence of presence of moderate to marked depression. And at this age, this level and at this high percentage, you need care like psychopathologists or the pharmacotherapist and the other ways to which you need to regulate your levels of depression and levels of the brain that are with less neurotransmitters. 72% means that the equivalent clinical global impression is show that you have a presence of severe to extreme depression, and it is at very high cases. For these people, maybe you need to visit a rehab center where you need to be rehabilitated. That is my most recommendation. If you find that is where your clinical global impression leads, you have to visit a rehab center, which is basically called a rehabilitation center. So this is how depression takes off of your mind, and this is how people don't notice, and that is what I've been calling, maybe that is the essence of the SDX index. So this is how it takes. First of all, there's a little of depression, maybe 50%. It goes on increasing day by day with the level of neurotransmitters decreasing and the volume of the brain that with less neurotransmitters increasing day by day. And this happens until depression takes over and you are normal. You cannot control tears, you cannot control crying, you cannot control your mood, you cannot control, you always have low libido. disturbed sleep maybe, and that is what I'm calling the high extreme case of depression. And in this case, these people will have ideas of self-destruction. You are seated alone, you are not able even to control. You have ideas of self-destruction, maybe suicide, which always maybe translates to death. And we need to reach these people before these such cases appear. So now, which is the way out of depression? Let us discuss some of the ways in which we can treat depression. First of all, we will discuss on the preventive measures of depression. One, we also say that prevention is better than cure. Preventive treatment. One is peer-to-peer talks, guidance and counseling, engaging yourself with a positive environment to break this to ensure that you don't have bleak and pessimistic views of the future. That someone can tell you that your future is bright, someone can tell you that you have hope in the future, and that is all that you need. The next is comes overs, and also what I want to tell us is to solve before extreme cases appear. If you know your STX index is controllable, kindly solve this before the extreme cases appear. And I'm encouraging that prevention is better than cure. The next slide, we want to look at the depression illness post-treatment. What I'm encouraging here is that depression is curable and anyone can recover from it and lead as normal life, as long as you follow the outlined procedures on treatment of depression immediately after diagnosis. That is from 50 to 59 or 50 to 70 and above as percentage STX index. One is by use of antidepressants. And how do antidepressants work? The antidepressants are the latest scans and studies of the brain structure and function suggest what? This suggests that antidepressants can exert neurotrophic levels, increasing the neurotrophic level from 10 to 80%, and this means that they can help sustain nerves, prevent them from drying, and allowing them to form stronger connection to withstand biological stress. The next thing is pharmacotherapy and psychotherapy. A combination of pharmacotherapy and psychotherapy is always recommended. You have physical therapy such as ECT, which is the electroconvulsive therapy. These are mostly carried out. These are medications carried out on the maybe rehab centers, or you can also visit your doctor or your psychotherapist to help you out in this. Lifestyle changes. Change your lifestyle. Maybe you have lost a job or lost an income. Maybe you can also think of changing a lifestyle changes. And there's one thing that Buddha said. The Buddhism would believe in Buddha, and this is one thing that Buddha said. At the cause of suffering on earth are as a result of desires. So if you reduce your desires, if you reduce your lifestyle expectation and potential, you are going to heal of this depression. The next thing is follow-up activities. You should notice some improvement on your symptoms in about 1 to 2 weeks of depression. The next, what I'm encouraging is that make regular appointment with your doctor to have your progress monitored. In this case, you are going to heal depression. Take medication always, and at the end of the day, you are going to win the fight against depression. Thank you for watching this video. I'm yours, Kwame Phineas.